Hi, this is Justin Berkemeyer. Today we're going to be presenting the Symmetry packet for acute care and why Symmetry is so important in a medical facility such as your hospital. So just to name a few, we just want to, showcase some of the large hospitals and organizations that we have partnered with that recommend our Symmetry product. A few of our large hospitals we work with: Aurora Healthcare Center, Kindred, BJC. We have Maine Health, Presbyterian, Signature Healthcare, Mercy Health, and the Shriners Hospital. And then some of the organizations that really recommend our Symmetry program is the Joint Commission, APIC, World Health Organizations, the CDC, FDA, National Quality Forum, and the ISO. So kind of jumping into our focus, right? We want to provide a product for healthcare workers they want to use with a reliable delivery system. Kind of our key motto is acceptance equals compliance equals lower HAIs. By creating a really good quality product that's not going to dry the hands out, not going to leave a sticky residue, you're going to have your employees more opted into wanting to use that product over and over again after each visit with a patient. Again, lowering that spread of HAIs. We also want to incorporate point of care and behavior modification tools to increase that compliance as well, in addition to reducing those HAIs. So some of the expectations that you would get with Symmetry, and through our clinical evaluation, we've been consistently preferred choice of medical and healthcare workers. As mentioned earlier, right, it's going to dry quickly on the hands, it's not going to leave a sticky residue, and it's going to keep those hands moisturized and hydrated. Excuse me. As well as, we have a great cost comparable for our product, our good competitive cost, and right, the whole point is to reduce those HAIs. So looking at a Duke University Medical Center study, right, they incur about $1.7 to $1.8 million a year, and that's expensed due to poor hand hygiene and non-compliance, right? And we saw that just by an increase of 1% of hand hygiene compliance, they were able to save $39,000, and that's on a hospital with 200 beds. So looking at a facility of your size, by increasing just by 1%, you can really see those savings, right? Just to conclude, right, the hand hygiene non-compliance is associated with significant attributable hospital cost. Minimal improvements in compliance can lead to subsequent savings. Just a few studies here, again, wanting to showcase the employees in certain hospitals and what they prefer in regards to Symmetry versus Purell. You can see the ease of use, the quality, fragrance, the fact that we are fast drying, the overall feel and comfort. Symmetry being in the blue, Purell in the pink there. You can see that a vast majority on every single level was preferred Symmetry over the 44 that preferred Purell. A few more comparisons here as well to Ecolab, right? At Presbyterian Health Services, again, these same tenets here of the easy, quality, fragrance, fast drying, feel, and comfort. That Symmetry was a vast, or a majority of the wins by a landslide were Symmetry, 104 to 7. And comparing to ICP Medical at the BJC Healthcare Center, again, there's no debate which is preferred. Symmetry by a landslide, 139 to 3. So we have our Symmetry unit test clinical evaluation through the BJC Healthcare Center. There's 440 beds, and within the 15 acute care hospitals, the 160 overall medical buildings, and the 3,400 staff beds. We want to look at some of these results and looking at their current product, right? I mean, overall, of course, it's a safe product. It's easy to use, but things that really stand out here, we can see in red. My skin does not feel irritated, not dry, chapped, or rough. See, a majority of the people in that study disagreed, right? And so if they're having that chapped, dry, cracked skin, they're not going to want to continue to use that sanitizing product because it's only going to make their hands worse. Also, seeing a 25% strongly, only 25% really agree that they would recommend the product based on performance. Now, when we jump over and look at when we did the same test in the same facilities with Symmetry, we see what those negatives were, again, across the board, easy to use, right? They accepted the packaging, the product dried quickly, but we saw a huge improvement on how the employees reacted to their skin feeling irritated. And when it goes to their skin does not feel irritated, we have 14% agreed, 77% strongly agreed. And when looking into if they would recommend that product based on the performance, 75% of them strongly agreed. Just a few quotes here from the BJC Healthcare. Dispensers for hand sanitizer have been installed throughout the hospital to save money and to provide a better product. Not only are the new dispensers more cost effective, the sanitizers contain vitamin E and aloe, which reduces potential skin damage from alcohol contained in sanitizers. And standardizing sanitizer dispensers across the BJC is expected to save about $200,000 a year. So, right, cost savings for you, you have better compliance, and we're lowering those HAIs, right? So some of the efficacy data that we have, our formulations follow the FDA's TFM. We have extensive irritation and sensitivity testing through like a patch as well, and benchmark efficacy standards. Also, cool thing about our Symmetry dispensers is, right, we can customize them to be branded for your facility. Not only the dispensers themselves with your logo brand, but we can also match as far as the color for your branding to really, make it feel a part of your facility, as well as customized placards that really can dive into more of the messages of care that you're giving to your patients. Here's just an example of the Shriners Hospital, right, where our normal dispensers would say Symmetry on it. We've removed that. We've put the Shriners Hospital down at the bottom and a logo, and also just some custom posters and placards to, again, really increase the awareness of the importance of hand hygiene. So falling into our behavior modification, right? We have our 6 tenets that we want to inspire, hygiene, compliance, benevolence, responsibility, accountability, variation, emotion, and direction. Here's a few of the kind of behavior modifications as far as the placards go, the posters that we'd have in different medical facilities here. Again, just creating awareness, giving some information to really stress the importance of hand hygiene in the facility. And again, these can be completely customized for your facility, but we do provide, of course, a standard line that you're happy to use as well. Something kind of fun and cool, right? We had those placards, but we also have our motive, which is a digital behavior driver placard. So it's completely customizable. We can put videos on it. If you want to have testimonials or things that are new, upcoming at the hospital, events, things of that matter that really want to get people interested, educated, and of course, driving home more awareness for hand hygiene. That is an option as well that we have. It simply just sticks onto the top. It is battery operated. And again, that video can attract people's attention, lead them over, and while they're there, want to use the Symmetry dispenser. We also do have a visual lighting cue, and it really just simply flashes a red light. And we have noticed that by incorporating that flashing light, we've increased compliance to 49%, just making people aware of this sanitizer in the area. Sometimes, people are walking around, they have things on their mind, especially in a hospital, whether it be a patient or visiting a patient. They're not really streamlined and focused, but as far as what they're thinking of, but by having a flashing light might catch their attention as they leave a room. They might want to use that. And just a study by the American Journal of Infection Control, a study of efficacy of flashing lights to increase the salience of alcohol gel dispenser is improving hand hygiene compliance. Also, another little fun, we have a behavioral beacon, and it, there's a few options we have, but when the sanitizer is dispensed, it will shine a emoji on the floor. We found this be great for, children's hospitals, things like that. Gives them, a sense of satisfaction when they get that Symmetry and they see a fun emoji of a smiley face or a heart or things like that. Again, really trying to drive home that behavior modification and associate, positive thinking with sanitizing of hands, right? So you have the just-in-time coaching, the positive reinforcement, and the patient engagement. Looking at sanitizer outside patient rooms, we've noticed an uptick as far as with the behavior modification when we included a mirror as the placard. Whether your staff is actively working through the halls, coming back from lunch, wanting to check their teeth just to see how they're doing, are they presentable? Again, having that mirror there will bring people up to the dispenser while they're there. They're more opted to use the Symmetry product. And the VLC yield that we saw with those placards as well, another uptick compared to not having that placard as well, right? We want to draw attention so that people are more accepting to use it. Now, actually looking into our products, right? We do carry a full line of hand wash products. We do have green certified foaming gel hand wash, and that also does come unscented as well. We have an antimicrobial foaming hand wash, and we also do have a hair, hand, and body foaming wash for your locker room, for your employees. If they are pulling long shifts and they're staying the night, we do offer that as well, that we can put in those locker rooms and those showers. As far as hand care goes, we do offer a moisturizing hand lotion with skin conditioning. And then for the sanitizers, I know that we've been really harping on, but we have the foaming hand sanitizer with aloe and vitamin E. We also do carry that in a fragrance-free, and we do have the non-alcohol version with allicin and aloe in it. Now, just to speak on the non-alcohol, of course, without that alcohol, it's going to dry a little bit slower, but again, still effective, same kill claims, all there. And you can see as far as different packaging goes, from what we would fit in the dispensers to, we have a nice hand pump that can be on a desk, as well as ones that can click onto a lanyard, and of course ones that can just sit in the pocket. So point of care here, just a quote from the Joint Commission. Beginning January 1st of 2018, any observation by surveyors of individual failure to perform hand hygiene in the process of direct patient care will be cited as a deficiency resulting in a requirement of improved RFI under the Infection Prevention Control chapter of all accreditable programs. Right, so we're really stressing the importance of hand hygiene here. And right, the point of care tools, right? We all want to be able to provide Symmetry at arm's reach, right? In any possible place within the facility. So like we said, we have little things here we can attach to the lanyard, so you can easily pull it out of your pocket. These can easily be placed onto the side table of the patient's bedside table. These can hook on to any of the carts, whether they're moving around with different with the EKG, any cart for medication, things of that matter. The anesthesia cart, sorry. And just a few images, right, as we said, with the point of care, having them on the side tables here, the tray table for the patient, for their bed, just on any tabletop. They do have a nice suction cup, so they're not opted to slide around. Just a few more images here. All right. Few of the monitoring systems that we're compatible with: Clean Hands, Swipe Safe, Preventex, and BioVigil. We also do have a hand hygiene observation app, so you can collect data to see how the acceptance and compliance is going within the facility and the overall use of that product. And with that being said, that concludes the Symmetry Acute Care packet.